Hey guys, me, it's Dr. M, and I want to go over some things with testosterone therapy because it's such a hot topic. Full disclosure, I do not prescribe or do any testosterone therapy myself or in this clinic, but I do want to give you some information because I research quite a bit. And if I have patients that are on that, which nowadays, quite honestly, it seems like everybody and their mother is asking about it and or taking it. And so I want to make sure that you guys are well informed because unfortunately, I'm seeing a lot of doctors, they're getting and jumping into this bandwagon, and a lot of them don't really know what they're doing, or they're going through the process of it, and no one's really getting the deep research. So I want to give you some of that, and I'm going to give you one thing today that you can walk away with that I'm seeing consistent problems with, that are people that are actually on testosterone therapy. So other things that might be misdiagnosed, okay? But again, I can't give you medical advice. I'm not your doctor. But this is something that you may want to talk to your doctor about. So now if you're on testosterone therapy, it's very important, I can't emphasize this enough, it's very important that they look at your hemoglobin and your hematocrit. Okay, now why is that important? Because what happens is when you're taking testosterone therapy is red blood cells go up. And so as that goes up, your blood, that basically means it can thicken. Okay, so what happens is a lot of times when people are going to get their blood tested, they're consistently seeing that their hematocrit or their hemoglobin levels are elevated. And so what do they typically do when they're on testosterone therapy? If they go to elevated, they're donating blood, and they're thinking that that's the best thing to do. And yeah, definitely you want to make your blood thinner, but they can't figure out why they have to consistently keep donating blood, and they think it's just because they're on testosterone therapy. And yes, that could be one of the reasons why, but here's another factor that if you're having issues with that you really need to consider. And here it is. What a lot of people are not considering is that you could have sleep apnea. And so if you're having sleep apnea, guess what happens? Your body thinks it's in a state of exercise all night long. And so if it's in a state of exercise all night long, if your spouse tells you that you're snoring, what happens is your red blood cells are going to go and elevate because you think you're in a state of exercise all day long. So your oxygen saturation in your body actually decreases. And so what your body tries to do is it tries to produce more red blood cells. And so as it does that, to bring the oxygen more into the tissue. And so sometimes you're thinking it's the testosterone that's causing you to have more red blood cells, and definitely could be happening. But the other reason that it could be also happening, you're allowed to have more than one problem, guys, it could be because you're having not undiagnosed sleep apnea. And so what I would encourage you to do is that if your spouse or someone that is telling you that you're snoring at nighttime, you're not feeling restful, and that could be not just because of testosterone, it could be because of undiagnosed sleep apnea. And so you could really correct that by not just donating blood, by going and getting yourself a sleep apnea test, and that could definitely help you. Hope you got something out of value today. I'm Dr. Masood. Take care, guys.